High blood pressure, also known as hypertension, is a condition that occurs when the pressure exerted on the blood vessels by the blood as it passes through them becomes high. When this is being measured, the resistance that the blood meets after it is pumped is measured. Arteries carry blood away from the heart, and they are the blood vessels that feel this pressure the most. If the arteries are narrow, the blood pressure increases. There are a lot of health issues associated with this. High blood pressure is common and develops gradually for years. This health condition is asymptomatic and shows no sign but is quite damaging to the blood vessels and the organs such as the eyes, brain, heart, and kidneys. The only way to find out this condition, since it shows no significant sign, is by a medical checkup. Detecting it very early is life-saving. Close monitoring and constant checks are done for the course of some weeks or months to help the blood pressure return to normal. Blood pressure chart. This is a chart that is used to know what blood pressure reading means. The blood pressure readings usually come as two numbers. The first number is called the systolic blood pressure, while the second number is the diastolic blood pressure. The systolic blood pressure is the measurement of pressure on the arteries when the heart pumps blood into it. The diastolic blood pressure is the pressure on the arteries as the heart is resting between beats. The pressure readings are in mmHg, millimeter of mercury, which is the manometric unit of pressure. The ranges of blood pressure readings are: normal blood pressure, below 120 mm of mercury systolic and below 80 mm of mercury diastolic. Elevated blood pressure 120 to 129 mm of mercury systolic and below 80 mm of mercury diastolic. Stage 1 hypertension 130 to 139 mm of mercury systolic and 80 to 90 mm of mercury diastolic. Stage 2 hypertension 140 mm of mercury or above systolic and 90 mm of mercury or above diastolic. Hypertensive crisis, over 180 mm of mercury systolic and over 120 mm of mercury diastolic. Taking a close look at these ranges, you will find out that even when only the systolic or the diastolic blood pressure is higher than normal, it counts as high blood pressure. Therefore, if the systolic blood pressure is 140 mm of mercury or above, the blood pressure is high regardless of the reading of the diastolic blood pressure reading. If the diastolic blood pressure is 90 mm of mercury or above, the blood pressure is high regardless of the systolic blood pressure reading. Symptoms of high blood pressure. When blood pressure rises, there are usually no signs or symptoms. But when the pressure rises as high as 180/120ths of a millimeter of mercury, the following can be felt, and this regarded as a hypertensive crisis. Some of the symptoms depend on the age, gender, and the underlying health condition of the person. General symptoms are 1. Headache. 2. Breathlessness. 3. Heart palpitations. 4. Nose bleeding. 5. Nausea and vomiting. 6. Dizziness. 7. Blurred vision. 8. Chest pain. 9. Bloody urine. Types of high blood pressure. 1. Essential hypertension. This is a type of high blood pressure whose cause is unknown. It is noticed when a doctor runs a diagnosis and discovers it. It usually not caused by any illness and develops over time. This type of hypertension is usually asymptomatic, and the person might feel dizzy, nauseous, or tired sometimes. Studies show that it could be caused by unhealthy diets, alcohol, smoking, obesity, and heredity. 2. Secondary hypertension. This is commonly caused by abnormalities in the renal arteries, blood vessels that supply blood to the kidney from the heart. It is also caused by obstructive sleep apnea, obstruction of the airways during sleep, too much sodium in the diet, alcoholism, disease of the adrenal and thyroid glands. Secondary hypertension can also be caused by medications like pseudoephedrine and ibuprofen. 3. Malignant hypertension. This is a very rare type of hypertension and is common among teenagers and pregnant women that have preeclampsia. It occurs when the blood pressure rises rapidly, with the diastolic blood pressure reaching as high as 130 mm of mercury. Symptoms of malignant hypertension are headache, chest pain, confusion, blurred vision, and muscle numbness. This type of hypertension is regarded as an emergency and must be treated in a hospital. 4. Isolated systolic hypertension. The blood pressure readings come in two numbers, the systolic and diastolic blood pressures. The systolic blood pressure, which is the pressure exerted on the arteries when the heart pumps blood through it, rises above 140 mm of mercury in this condition. The diastolic blood pressure, however, remains normal or below 90 mm of mercury. This type of high blood pressure usually occurs in people above the age of 65 whose arteries are no longer elastic. 4. Resistant hypertension. This is the type of high blood pressure that remains constant even after using different types of medications. This is usually noticed in hypertension caused by either obesity, age, race, kidney disease, diabetes, or is inherited. Causes of essential high blood pressure. It is still quite unclear what causes the blood pressure to gradually rise. It is believed that several factors may contribute to this condition. These factors are: 1. Genetics. Some people possess genes that make them more susceptible to developing high blood pressure than others. These abnormal genes are hereditary and can be transferred from generation to generation. 2. Unhealthy lifestyle. Lack of physical exercise, consumption of sugary and fatty foods, smoking, and alcoholism can increase one's risk of developing high blood pressure. 3. Poor mental state. Being in a constant state of panic, fear, anxiety, worry, depression, stress, and hopelessness can trigger an increase in blood pressure. Causes of secondary blood pressure. Secondary hypertension happens quickly and is more severe than primary hypertension. The causes of secondary hypertension are thought to be: 1. Heart disorders present at birth. 2. Kidney diseases. 3. Obstructive sleep apnea. 4. Thyroid and adrenal gland disorder. 5. The side effect of some medications. 6. Drug and substance abuse. 7. Some endocrine tumors. 8. Alcohol abuse. Dangers of high blood pressure. High blood pressure damages the body gradually before symptoms start to show. If it is not detected early or is not properly managed, hypertension could result in stroke, disability, and even a heart attack. High blood pressure in the arteries. Arteries are supposed to be elastic and strong. But when fats gotten from the diet enters the blood, they get deposited on the arterial wall. This buildup of fat causes the arteries to become narrow and stiff. The narrowness of the artery makes the pressure that the blood exerts on it when it is pumped by the heart to increase. Hypertension damages the artery by aneurysms. This is a bulge formed on the artery as the blood is trying to push its way through its narrow walls. Over time, this bulge could burst and cause fatal internal hemorrhage, bleeding. Aneurysms are commonly formed in the aorta, although it can be formed in all arteries. High blood pressure in the eyes. High blood pressure affects the tiny blood vessels that supply blood to the retina. This could lead to several damages like: 1. Hypertensive retinopathy. Hypertension and vascular blood vessels diseases affect the tiny blood vessels of the retina and damage them. It is also an indicator that there is also damage to the blood vessels somewhere in the body. Sometimes, this could lead to blindness. 2. Optic neuropathy. Narrow or blocked arteries could reduce or stop the flow of blood to the retina and the nerves present in it. The optic nerve could be damaged, leading to internal eye bleeding or total loss of vision. High blood pressure in the heart. Hypertension can cause a lot of problems for the heart. Such issues are: 1. Enlarged heart. This is caused when the heart works extra hard to pump blood around the body. This makes the left ventricle hard and less elastic, and this could lead to heart failure, heart attack, and even cardiac death. 2. Coronary heart disease. The arteries that are narrow due to the deposits of fats can be damaged when the blood pressure increases and puts a strain on them. The lack of elasticity of these arteries can also decrease the rate of blood flow to the heart. This can cause angina, chest pain, arrhythmias, irregular heartbeats, and even a heart attack. Heart failure. The strain put on the heart by the effects of the high blood pressure weakens the heart muscles and it starts to fail. High blood pressure in the kidneys. The principal function of the kidney is to filter off waste from the blood. This is made possible by a regular supply of blood to it by fully functioning blood vessels. When the blood vessels that supply blood to the kidneys are damaged, a lot of health issues could arise. Such issues are, 1. Glomerulosclerosis. This is the hardening of the blood vessels found in the kidneys are known as the glomeruli. Their function is to filter blood while it passes through the kidneys and remove wastes. These wastes are removed from the kidney as urine and it flows to the bladder. When the glomeruli are damaged by high blood pressure, they fail to carry out their functions properly. The proteins in the blood begin to pass the glomeruli filters into the urine. This occurrence is known as proteinuria. 2. Kidney failure. The blood vessels of the kidney glomeruli are damaged by the pressure that is exerted on them by the high blood pressure. As a result, the kidney can no longer successfully filter waste. This gives room for dangerous wastes and unwanted fluids to accumulate in the kidney. This leads to kidney failure and may require kidney dialysis or transplantation. High blood pressure in the brain. The brain needs a constant and sufficient supply of blood to be able to function properly. High blood pressure could stop that from happening and can cause problems like 1. Stroke. This occurs when the brain is running low on nutrients and oxygen. The arteries that supply blood to the brain from the heart could rupture under the immense pressure. This will form blood clots in the arteries and prevent enough blood from reaching the brain. This reduction in the quantity of blood reaching the brain will reduce the quantity of oxygen available to the brain, resulting in a stroke. 2. Transient ischemic attack (TIA). This is also known as a mini-stroke. This happens when there is a brief delay in the supply of blood to the brain. This is caused by the same conditions that lead to a stroke. This often comes as a warning that a full stroke is underway. 3. Dementia. This is characterized by a decline in language, memory, and problem-solving skills involved in the performance of daily activities. Memory loss is one of the manifestations of this disease. Dementia occurs when the arteries are narrowed by fat deposits or blocked by blood clots, thus reducing the blood supply to the brain. This is also known as vascular dementia. High blood pressure and sexual functions. Men that have high blood pressure experience reduced blood flow to their genitals. This will result in erectile dysfunction and the inability to retain an erection for a long time. Women that have high blood pressure experience sexual difficulties. Lower vaginal blood flow could cause vaginal dryness, low libido, lack of orgasms and painful intercourse. If you enjoyed this video, click the subscribe below. Visit our site, www.zymsupplementguide.com for more content like this.